Women over the age of 40 or 50 have a significant decrease in estrogen secretion, which can lead to menopausal syndrome, decreased libido, headaches, dizziness, anxiety and depression, irritability, insomnia, restlessness, lack of concentration, forgetfulness, osteoporosis, etc. Therefore, in terms of the diet and nutrition, women over the age of 40 should pay attention to supplementing foods rich in plant estrogen, such as legumes. Soybean flavonoids can play a dual regulatory role in estrogen levels in women, promoting an increase in estrogen levels. When estrogen levels in the human body is relatively high, it can moderately reduce estrogen levels and exert antioxidant function. Some experts found that the phytoestrogen contained in the beans will occupy the estrogen receptor on the surface of human cells after entering the human body, preventing real estrogen from stimulating highly sensitive tissues, thus reducing the occurrence of estrogen-related cancers, especially breast cancer and uterine cancer. In fact, in Japan, which loves bean products such as tofu, the proportion of women suffering from breast cancer is far lower than that in European and American countries. However, soy isoflavone health products should be avoided by patients with uterine fibroids, as they contain a high amount of phytoestrogen. There are many foods that contain phytoestrogens such as beans, wheat, fennel, garlic, onions, sunflower seeds, black rice, sesame, oats, celery, rice, mung beans, sprouts, etc. Moreover, there are many nourishing medicinal herbs that can also supplement phytoestrogens, such as tomato fuciformis, lotus seeds, mulberries, lilies, bird's nest, goji berries, ginseng, Angelica sinensis, Cordyceps sinensis, American ginseng, and so on. Among them, leguminous plants contain the most estrogen. Therefore, in addition to the normal diet, women after the age of 40 should try to supplement more bean products, soybean milk, various beans, etc. It should be noted that, despite a significant decrease in estrogen levels in women, it is important to avoid consuming foods with high levels of animal estrogens, such as chicken, beef, and pork, that have been extensively fed with hormones. These animal hormones can stimulate the proliferation of breast, ovarian, and cervical cancer cells in women, leading to the induction and the metastasis of female cancer cells. The high incidence of breast cancer, ovarian cancer, and cervical cancer in women is mainly related to the high level of estrogen in the body, in addition to emotional factors. In addition to the influence of exogenous and animal estrogen intake, estrogen in the human body is transformed through cholesterol. In addition to the ovary, this transformation can also be carried out in adipose tissue. Consuming a high-fat, high-cholesterol diet can promote the generation and the release of estrogen. According to statistics, the incidence of uterine fibroids in obese women is significantly higher than in those with normal weight. Therefore, the post-40s women who are at risk of breast cancer, ovarian cancer, and cervical cancer should follow the principle of high protein, high fiber, and low fat in their diet. Try to eat less greasy food such as fried and barbecue, and maintain an appropriate body fat ratio in order to prevent excessive estrogen levels. In addition, it is recommended to consume more foods that contain substances that inhibit estrogen, such as shiitake mushrooms, brown mushrooms. Research has found that these foods contain substances that inhibit aromatase. Aromatase is an important catalytic enzyme for the synthesis of estrogen in the body. Once the catalytic enzyme for synthesizing estrogen is inhibited, the level of estrogen naturally decreases. South Korean once found that if there were more mushrooms in the diet, the risk of breast cancer before menopause would be reduced by 65 to 70%, as ovarian cancer is also related to estrogen. Consuming certain mushrooms in moderation is also beneficial for the prevention of ovarian cancer.